Good evening. This is Dr. Mobi with Lifestyle with Dr. Mobi. Welcome everywhere, international and national audience. Firstly, we are going to talk about current situation as well as we're going to welcome our great guest, Dr. Nadeem Mukhtar, who is hospitalist. Welcome, doctor, to our program.
Thank you for having me, Dr. Mobi. This is
Okay.
Nadeem.
Thank you. And before we go in main introduction, I'd like to point out a few things. This COVID-19 crisis has put healthcare providers at the front line of this pandemic, and we are dealing with a lot of issues. We are really everybody from the groundwork, people who are putting groceries, cleaning hospitals, making sure everybody is safe, and everybody is putting their best to this crisis. And healthcare providers are at the front, so we really honor all of them, or everybody from every level, but especially for healthcare providers. And the important role for healthcare provider is hospitalists. Those are the one actually admit most of patients to the hospital. Of course, all other providers also deal with outpatient. So those are really important when we deal with this crisis. So today we're going to learn about um, again hospitalists, their lifestyle, and how they are dealing with this situation. So, Dr. Nadeem Mukhtar, tell us about yourself, and then we'll proceed with our program.
Okay, thank you once again, Dr. Mobi. It's a pleasure to have on talking to you over this program. Thank you for having me again. As you just introduced me, I'm one of the hospitalists of many who are fighting against COVID at this time. I myself work in Sacramento area as a hospitalist, and being hospitalist, my role is to take care of the patients who are admitted in the hospital who are much sicker. And over the last month or two, the greatest challenge was so many COVID-19 positive patients. I myself have been on front line, and I have taken care of so many patients being admitted on first week of the April. It was really hard where we were seeing a bunch of patients on every single day, admitting many of them, some of them mildly ill to much sicker, requiring intubations or being on ventilation.
Okay, thank you. For audience, let's kind of educate a little bit about what will be the some of the signs symptoms of COVID-19 patient, and when somebody should be admitted to the hospital or the admitting criteria. You can highlight some of these.
Right. So I will start with the most common symptoms. So COVID 19, even though not a regular flu, the symptoms can be very similar to any flu. I would start with some common symptoms that can be presented on this disease. They will be fever, cough, or shortness of breath. Those are the three main. If you have one, two, or more, it's a good idea to think about that you are getting sick and you should be getting attention from a medical care provider. I would also like to say a few other symptoms, which will be body aches, muscle pains. If you are having sore throat like symptoms, another thing that we have been seeing in COVID 19 patients is loss of taste or smell. If you have any of those, you should be seeing a medical professional. On the other hand, some of the symptoms that are more severe that will be trouble breathing, persistent shortness of breath or chest pain, and if your lips are blue or if your face is turning blue, it's a time to go to the ER.
And I think that's a very informative for our audience. I also want to always point out there are a few things which people can do commonly. They look for fever, number one. Second is, now if you have pulse ox meter, that is very, very helpful at home. And people who have Apple Watch or some kind of watch device, that also actually can tell your oximetry, and that I have found very helpful. For other things are your respiratory rate, so that's the way we breathe. And if you can't talk, then that means that you have hard time breathing. and you should really don't ignore it. You really need to be evaluated by healthcare provider. So having and fever on top of that, so it's very important to realize and differentiate those. And most luckily most will get better by home treatment, but which means that a lot of people can get better at home, but some needs hospitalization, but it should be properly evaluated everybody. So some of the findings, maybe what you have seen, doctor, do you see a lot of x-rays and being abnormal, or what are your findings on these patients?
Yeah, as you mentioned, all of the points, they were wonderful, and we have seen those very commonly. I would also like to mention that some of the symptoms that we usually don't relate to COVID or flu-like symptoms were nausea, vomiting, or abdominal pain. And I have seen some patients whose initial presentation was just GI symptoms, and they ended up getting COVID-19 positive, and they get really sick in a couple of days, requiring up to intubation. The X-ray findings, yes, initially when we started in late March, the test was taking many days to come back. We were relying on some of the radiological findings, even though we were trying to limit our resources and not utilize CT scan. In more severe cases, we were utilizing X-rays for sure, and it was being very helpful. Currently, we are capable of testing COVID-19 within 15 to 20 minutes, and X-ray is always helpful, but we are able to do COVID testing before they even get assigned to a room.
Okay, well, thank you for telling us that. Also, would like to go a little bit. What kind of with PPE problems, for the healthcare providers, are they having issues in terms of hospitals not able to provide that, or is not a problem in your area?
So initially there were issues when we were trying to limit the use. There were days when I have used an N95 for all day or more than a day on a bunch of patients. But currently we have enough supply of PPE, and I feel comfortable when I walk into a room who is suspected COVID, and there is N95 and all other PPE available to me.
Okay.
So it has not been an issue recently.
Okay. And also want to tell the audience that our guest is being awarded, actually has been awarded for his dedication and work as a hero for the from the hospital and the local authorities. So tell us a little bit about your award.
Yes, this was a nomination that's called COVID-19 Crisis Hero. I really don't feel like I was doing anything beyond my daily duties that I was supposed to do anyways, but my employer and some of the coworkers, they are kind enough to nominate me as COVID hero because I have dealt with many patients who were sick with this disease, and some of them, even though not able to make up, they lost their lives to this disease, but most of them were recovered. So I was nominated as COVID crisis hero just for doing my regular job that I was supposed to do anyways.
Okay, well, congratulations. I think it means a lot to all of us, and being also in healthcare provider, it makes us all feel very, very proud of your achievement. Congratulations.
Thank you,
Also,
Doc.
thank you. So also want to ask you, what motivates you every day to go for this, lot of duties, of course, endless hours.
So I have worked most of April. What motivates me is, I mean, as I just said, so many patients were getting better, and just to be able to talk to them when they are recovered and talk to their families. During this crisis time, we were eliminating guest visits from the families, so they were not allowed to come to the hospital. So I was talking to the families over the phone, and just being able to talk to people who were getting better. It's priceless, and it just keep you going when people get better.
Hmm. Okay, well, that's great, and I know it is a lot of passion for your job being doctor and healthcare provider. You know, you are that's our passion that keep us motivated even through this crisis. And I also want to point out there are a lot of doctors and healthcare providers who lost life, including nurses as well as doctors. In one study, they found a lot of minorities lost more lives, also relating to being provider from minorities lost a lot of life. Do you have any comment on why it would affect more minorities versus?
So in general, when we talk about minorities or ethnic group, generally the death rate or the disease is usually higher in those groups. So very similar to COVID, actually, we've been seeing a little bit more in that because the effects of COVID-19 in racial or ethnic groups are still being studied. But what they have learned so far is the disease burden as well as the death rate was much higher when they compare the rates to the whites. So there are several factors. I mean, the way they live, where they go for work. I mean, it just all contributes. I would also like to point out that so many of the minorities, to begin with, they have diabetes, high blood pressure, or obesity to start with, and that does not help. It just predisposing factors to this illness as well.
And I think you said it right. There is a big opportunity for lifestyle changes, and there was, I think, recently a study risk factor for a lot of these with the healthcare provider as well as general population, and that can actually cause a lot of problem for this with COVID-19. So I think that is always a problem when we deal with it. So tell us also a little bit about your other. Uh, how do you keep yourself motivated and keep yourself fit with this lifestyle change?
I myself, I mean, I work long hours. I try to keep myself healthy as much as I can. The motivation, of course, I live with a family, and one of the initial challenges were I hope I'm not bringing anything home, as I have my 8-year-old son living with me. But then it's just being more cautious for my family, which I love the most. At the same time, when I love to treat my patients, it's just a difficult balance. And keeping yourself healthy is very important when you're taking care of your family as well as your patients who are precious to you. So as we just talked about keeping yourself healthy, I have been trying to do a walk in the evening, just listen to light music and just catching up with my family over the phone in this era when we have to maintain physical distance. That's what I've been doing at this time. Are you there?
Also want to ask you for also any tips you would like to share with audience about how to keep somebody healthy and fit for any lifestyle, like what better eating, what is your normal typical routine?
Right. So, I mean, the three things that I mentioned is diabetes, high blood pressure, or cardiac risk factors, as well as the weight or obesity. So, just by eliminating those three, we can not only eliminate COVID-19 risk factors, we can eliminate many others, the common diseases, especially that affects racial ethnic groups, um, to include diabetes mellitus, cardiac risk factors, and the list keep going on. So I think just by eating healthy, sleeping well, and doing a regular walk or a jogging, that can change so many things. I would also like to include tobacco smoking. That's also a risk factor, and that can help with all of the above.
Thank you for sharing all that. So, any final thoughts on uh, for lifestyle you want to share with the audience?
I would just have a suggestion, a recommendation. I mean, how to get rid of this epidemic is really finding a vaccination or a treatment that really works, or that's ideal. But we are not there yet. So what we can do at this time is continue to maintain physical distance, repeated hand wash throughout the day, and keeping body hygiene, as well as wearing facial mask at this time. That's the best we can do at this time.
Thank you. So, for final thoughts, I would just again point out: make sure everybody should take care, whether you're a provider or whatever role we have. We have to make sure our lifestyle is adjusted, and we want to have balanced approach. So you want to control your uh, make sure your blood pressure is good, make sure your blood sugars are good, make sure you are walking and eating properly, right. Best defense for against COVID or any major medical issues is your own health, because we want to emphasize that, especially it's very important for healthcare providers, because we are on the front line. There's not a definite treatment yet. There are a lot of good approaches for treating COVID or other illnesses, but ultimately it comes down to our own health. And if we don't keep it in good shape, unfortunately we can have a lot of problems with any problem. So it's very important that we really work on prevention, and prevention is better than cure. So for COVID-19, you want to make sure keep an eye on your health and do best we can. So make sure get plenty of sleep, and you want to have good for your immunity. Second is you want to eat right and also make sure that's better. Third is you want to have a mask, and make sure if you're not feeling well, quarantine, and making sure don't get others sick. So with that in mind, we want to make sure everybody is safe. And thank you once again, Dr. Mukhtar, for coming and taking time from your busy schedule. And if you have any final thoughts, you can share. But thank you, audience, for watching. Make sure keep us informed and keep us with your feedback and questions. Um, any final thoughts, Dr. Mukhtar?
I think you said it very well, so I have nothing else to add to your statement. I appreciate your time. Thank you so much.
Thank you. Thank you once again, and thank you for watching our show, Lifestyle with Dr. Mo. Good night.